We see the opioid crisis, which is indeed a really profound, deep crisis, but we see it as part of a larger picture in which there are deaths of despair caused by suicide, by alcoholism, and by drug overdose.
No one goes out and says, I want to become an opioid addict. What are the roots in that? Partially it could be a gotcha that, you broke your arm and we gave you too many drugs and now you're addicted. But part of it also is that people turn to things like drugs, like alcohol, when they don't see their lives leading anywhere. Well, we know the proximate causes, which is that opioids are being given to people like candy. The deeper causes we really have to look at as well. And as an economist, I think a lot of those have to be economic.
The cost to the taxpayer, cost to our healthcare system, they're immense. When you look at the medical expenses, the criminal justice expenses, the cost to the private sector through lost productivity and wages, and then cost to social services, foster care, things like that. So we are beginning to now have a real workforce issue in North Carolina where employers want to hire folks, but they can't pass the drug screens or they can't pass the criminal records check. And so it is starting to have a real economic impact on our ability to compete and progress forward.
162 people in our country die every day from opioid addiction and overdose. That's equivalent to a commercial jetliner going down every day. And if that were happening, the social and economic impact would be a major outcry that would not be tolerated.
In our study, we found that in 2013, the economic burden of prescription opioid abuse, dependence, and fatal overdoses was $78.5 billion. We also found that public sector sources are responsible for about a quarter of those costs, and a third of the cost is borne by the healthcare system. So preventing these kinds of things before they start can be very effective in reducing the economic impact that they have.
We think the evidence is going to show once we're done that the cancer is in the labor market. That people starting in the 1970s with only a high school degree suddenly couldn't get that job with on-the-job training, that job with benefits.
It's affecting the whole state. It doesn't discriminate. People with addiction are white, black, rich, poor, old, young, urban, rural, Democrat and Republican. And that's why this isn't a partisan issue. This is an everybody issue.
You know, the Raleighs, the Greensboro, the Charlottes, they're generally doing fine. I look at eastern North Carolina. If you look at my 29 counties of where my referral area as a physician is, if you put that together as one state, we'd be the poorest state in the country. And so to get people in those communities employed, we cannot have them addicted to medications because no employer is going to want to come in and plop down their big expense, their big investment in a community that's not going to be able to have employees to do their jobs.
This is an example of a problem that's multifaceted, and so it's not just a healthcare problem, it's not just a public health problem. It needs, a multifaceted, coordinated kind of solution.
I think the Kenan Institute did a fabulous job of bringing together all these individuals to work on a solution to a problem. We have facts, we have opinions, we have commentaries and emotions, but until we put them all together and move forward, we can't solve this problem. So I appreciate the Kenan Institute bringing everybody together.
And I know that I left with a stronger sense from some of the questions asked in the audience about community. And the fact that this is a problem that communities are going to have to focus on, and that business might be able to help that by investing in the community.
I think private enterprise is starting to realize the huge economic impact of the crisis, but for that sector of our country and economy to get involved in the opioid epidemic is going to be the piece that we've been missing. And given the magnitude of the problem, we've got to get everybody involved.